Good day, Mr. Hogg. I'm here today to present to you the pathological condition that I chose, and it's a myocardial infarction. The next slide is the outline of the myocardial infarction. First, we have definitions, the etiology of pathologic conditions, the specific cells, tissues, and organs that are affected, the signs and symptoms, the treatments and preventions, the short and long-term consequences. The myocardial infarction definition, other names, heart attack, permanent damage to the heart muscle. Myo means muscle, cardial refers to the heart, infarction means death of tissue due to lack of blood supply. The etiology of myocardial infarction is the next slide. The most common cause of MI is a blood clot that forms inside a coronary artery. The high cholesterol is the first one, which is colorless substance that's found in the food you eat. Not all cholesterol is bad, but LDL cholesterol can stick to the walls of your arteries and produce plaque. The other cause of MI is also from saturated fats. This may also contribute to the buildup of plaque in the coronary arteries and found mostly in meat, dairy products, including beef, butter, and cheese. These fats may lead to an arterial blockage by increasing the amount of bad cholesterol in your blood system and reducing the amount of good cholesterol. And then we have trans fat, another type of fat that contributes to clogged arteries. Trans fat is usually artificially produced and can be found in a variety of processed foods. One of the other common causes of MI is diabetes, which is due to high blood glucose. It's also smoking, one of the reasons that increases the risk of heart attack. Specific cells, tissues, and organ affected. Essentially, all of the organs can be damaged if the heart is severely damaged. It can't pump an adequate amount of blood to oxygenate the organs. If the kidneys do not get enough blood, then kidney failure can occur. The same with circulatory and respiratory system. They're also affected by heart attack. The biggest organ is the heart. When a heart attack occurs, many organs can potentially be affected, but frequently only the heart muscle is directly affected. The signs and symptoms are unique to each individual patient, ranging from no symptoms to sudden cardiac arrest. The following are the symptoms you are more than likely to have. Chest pain is often severe, while other times there will at least be a mild discomfort in the chest that feels like heartburn. The chest pain is described as pressure, heaviness at the chest, and sensation. There's also shortness of breath. There is more than likely that you have a medical problem if you experience a shortness of breath. This could be from asthma or lung infection or heart problem. If shortness of breath is persistent, you have to seek help as soon as possible. Nausea and vomiting is also one of the signs and symptoms. Not everyone will experience this, but vomiting results as a reflex from severe pain. Sweating could also be one of the symptoms, which may be extremes. The treatment varies depending on how much damage the heart has received and ranges from the administration of various medicine to surgical procedure. Blood thinners such as aspirin are often used to break up blood clots and improve blood flow through narrowed arteries. Usually, beta blockers lower your blood pressure and relax your heart muscle. Thrombolytics are also often used to dissolve clots. Aside from medicine, most treatments begins in the emergency room, a surgical procedure called angioplasty. During angioplasty, a thin flexible tube with a balloon on the end is threaded through a blood vessel to the black coronary artery. Then the balloon is inflated to push the plaque against the wall of the artery. This widens the inside of artery, restoring blood flow. Also, a small mesh tube called a stent may be put in the artery to keep it open. Some stents are coated with medicine that help prevent the artery from becoming black again. The other procedure is the coronary artery bypass graft. Your doctor may also want to perform CABG in some cases. In this procedure, your surgeon will reroute your veins and arteries so the blood can flow around the blockage. A CABG is sometimes done immediately after a heart attack. In most cases, however, it's performed several days after the incident, so your heart has time to heal. To prevent yourself from MI, you must keep your blood pressure, blood sugar, and cholesterol under control. Eat fresh fruits, vegetables, and low-fat lean meat like chicken and fish. Avoid red meat if possible. Take aspirin once a day with your doctor's approval. You also need to exercise if you are overweight. The short-term effects of myocardial infarction are to take the steps to reduce the risk of a second myocardial infarction and to keep the heart as healthy as possible. These steps often involve lifestyle changes and things like smoking cessation, healthy diet, cholesterol, weight control, all come to play if applicable to the persons involved. The long-term consequences of MI depend on the extent of resulting heart muscle tissue death. When oxygen supply to the heart muscle is prolonged, irreversible tissue death results. A typical heart attack can kill roughly 1 billion cells, and the heart is unable to replace these dead cells fast enough to recover from the damage, and the efficiency of the cardiac system deteriorates. The following are parts of the long-term consequences due to MI. The need to exercise. So increase blood flow to the heart, increases the timing of contraction, and like exercising, skeletal muscle creates a stronger heart muscle. Lifetime medication, often a daily dose of various maintenance medicine, are prescribed to be taken indefinitely. Physical activity changes. It's also a person will not be able to do the same physical activity that they did previously, and this will be limited. Changing diet, you also need to watch what you eat and exclude all the food with saturated fat and trans fat. Eat fish at least twice a week and a lot of fruits and vegetables. Avoid red meat. The next 3 pages following are all the reference for this presentation. And this concludes this presentation. Thank you so much and enjoy your day.